name is Kaylee and I'm a first-year biology student at UT Austin, and I'm going to be interviewing you today on behalf of my group in our introductory biology class about you, your occupation, and how it relates to biology. So could you please start off by telling me your name and your official occupation title?
My name is Richard Reinap. I'm a veterinarian, practice at BK Veterinary Clinic.
Okay. So when did you decide that you wanted to officially be a veterinarian?
So I announced to my family that I wanted to be a veterinarian when I was in 4th grade. I just finished a research paper on the Galapagos Islands, and then I told my parents that I wanted to be a veterinarian for exotic animals at that time.
Interesting. Okay. So I'm going to start off by asking you a couple of questions about college. So what colleges did you attend and what majors did you pursue?
So I attended Texas A&M University out of high school. I probably took a class or two at ACC during the summers, but I attended Texas A&M University right out of high school. The majors I pursued when I first enrolled at A&M, I was a biomedical science major for I think 3 semesters, and then I changed my major to poultry science. Finished my undergraduate degree, Bachelor's of Science in Poultry Science, and then I went on to do a master's degree, Master's of Science program within the Poultry Science department, where I worked on immunology using chickens as a model. And then after that degree, I worked full-time for a couple of years, and then I went back to Texas A&M University to the College of Veterinary Medicine. Did that and finished that in 2005.
Okay. So the classes and opportunities that you pursued in your undergraduate school, how did those particular classes make you change to the poultry? Like, how did you decide that you wanted to go towards that track?
So I switched my major to poultry science for basically two reasons. One was that biomedical science program at Texas A&M University is the largest college at Texas A&M. So there are a lot of students in it, and most of the classes are very large. And I felt like I wanted to be in some classes that were smaller. So poultry science department, that was possible there. The second was that biomedical science degree plan was very broad-based, and although it had a lot of basic information, it was not necessarily applicable, being able to be applied immediately to some sort of job. And so by going to poultry science, then I was actually learning very practical things about the poultry industry and so forth.
Okay. So you said you went on to graduate school after that. So how did the upper division classes help you prepare for graduate school?
So my upper division undergraduate courses. So my goal was always to go to apply and go to veterinary school. And knowing this, I had to take certain prerequisite courses to be able to apply to veterinary school. So there were courses that I took outside of my poultry science degree plan to account for those. So those are the ones that probably helped me there. Then you also have to take the GRE test, do that. And then in graduate school then, like I said, we did upper level coursework like in immunology and biochemistry and so forth.
Alrighty. Okay, so now I'm going to ask you a few questions about how you got to where you are now and what being a veterinarian entails. So many students after graduating are faced with the question of what do I do now? So after you finished grad school, what were like the main steps you took to like build yourself up to being the owner of your own veterinary clinic?
So after I finished veterinary school, I went, like anybody else, I had to go look for a job. Okay, the first position I was looking for was actually a position in mixed animal practice, which would be some small practice, dogs, cats, so forth, and then also some large animal medicine, working with livestock and horses. And so searched and interviewed many places around Texas, and I ended up in Southeast Texas, far Southeast Texas, and at a practice there, and I practiced there for a couple of years, and then was recruited to a practice in the Lockhart-Luling area. It was also a mixed animal practice, and practiced there for about a year before I decided that I wanted to open my own practice. And with that, it entailed going and finding where I wanted to open this practice, not just the city, but also the actual location, finding the building, and getting a business entity formed and that sort of thing, and getting the doors open.
Yeah. It's cool that you did it so quickly. That you're able to, open your own. That takes a while for some people, I know. So
Sure. I previous to going to veterinary school, I had worked over the course of about 10 years at a veterinary practice.
Mm-hmm.
And so of my veterinary school class, I was the oldest male graduate of my veterinary school class at the time. So I probably had a little more experience out in a general practice than some of my classmates did.
Okay, so can you kind of outline for us what a typical day here looks like?
Okay, so most days, if it's at least Monday through Thursday, if we have any anesthetic procedures, whether those be surgeries or dental procedures, we're going to do those in the morning so that those patients have time to recover from their anesthetic procedure. There are times where we have walk-in emergencies or other appointments that need an appointment for the morning time that will come in during the morning. And then usually the afternoons are filled with other outpatient appointments, have to do with everything from lameness cases to internal medicine cases, doing the discharges on the patients that were here with us that had anesthetic procedures, and so forth.
So what types of animals do you specialize in, and do you treat animals out of that specialty also?
I don't specialize in any particular animal. My practice is basically limited mostly to dogs and cats. I do see some other types of animals on occasion, such as pot-bellied pig, a pygmy goat, a hamster, guinea pig, some birds now and then, but I don't see those on a regular basis. So usually if somebody is inquiring, I let them know that that is not a regular part of my practice, but if they're still wanting me to try and help, then I will try.
So what specific disease or illness do you deal with the most often, and how do you treat it?
The specific one most often. Probably I'm gonna say that I deal with the most often, as far as disease process, things like atopy. Atopy is allergies that are based from environmental allergies. We see a lot of that. A lot of people in the Austin area have allergies, and so do their pets. Those allergies then can make the pet predisposed to other things like ear infections, bacterial and yeast infections on the skin, and so forth.
Okay. So now I have a couple of questions about how biology particularly is applied to your practice. So how do you apply your knowledge of the biological anatomy of an animal when you are diagnosing a sick animal?
Okay, so anatomy, I'll give an example of a case that I was working on right before you arrived to do this interview. A case of a dog that was having trouble breathing, was having a lot of labored breathing and very rapid breathing. And so by knowing the anatomy of that dog, when I auscultated the thorax, the chest, then I know where I'm what area of the lung fields that I'm listening to based off of where I place my stethoscope. And then also we did x-rays, thoracic x-rays, and knowing the anatomy of the normal anatomy lets me see what's abnormal about the lungs and everything that's inside of the chest cavity.
Okay. So also, do you look at the genetics of a sick animal at all when diagnosing them? Or like
Sometimes, yes, sometimes genetics come into play. Certain breeds are genetically predisposed to certain diseases. For instance, Cavalier King Charles Spaniels have genetic predisposition to certain heart diseases. We don't see it as often now, but some breeds such as Labradors and Rottweilers can be predisposed to having hip dysplasia.
So then you can use those genetic issues that have been known in the past to help you like further their health?
So that knowing their genetic predisposition to these diseases allows me to better build a differential list when they come in showing exhibiting certain signalment or certain signs. And so that helps me to better provide treatment specifically to what's their ailment might be or recommendations as to treatment.
Okay. So when you take the fluid samples from animals, what exactly are you looking for? Like whether it's blood or urine or whatever, what exactly are you looking for inside that sample to determine if it's an illness or what type of illness?
Sure. So going with we'll separate those out some. So one thing we look at are complete blood counts. Complete blood counts tell us what types of cells there are in the bloodstream, and those include everything from the red blood cells, the white blood cells. There's different types of white blood cells. Those different parts can tell us if there's inflammation going on in the body. If we look at red blood cells, are we low with red blood cells, and does that show anemia in that patient? Are we high with red blood cells, showing polycythemia in that patient? Another big category would be chemistries and electrolytes, and those chemistry and electrolytes can look at different values that pertain to kidney function, liver function, the amount of protein that's being held in the blood itself, that's used to carry other molecules around, things of that nature. Electrolytes being those molecules that help with the basically the electrical signals that operate pathways in the body. Urine, we're looking to make sure that there's not any bacteria present that might show there's an infection. We're looking to see that the urine is concentrated well, that the kidneys are doing their job to concentrate that urine.
All right. Okay. Now I'm going to ask you more about your personal opinions on being a veterinarian. So what is like the most challenging part of being a veterinarian, like overall?
So the most challenging part of being a veterinarian has to do with working with people, not with working with animals. So I would say that for people that want to become veterinarians, if you plan to be a veterinarian that works on people's pets, those pets that they bring to you, they can't speak for themselves. And a lot of what we do in our job on a day-to-day basis is work to gain history of what's been going on with their pet. In order to gain that history, we have to learn how to communicate well with those pet owners. Also, those pet owners themselves may have differences of opinion, may go to what we call referred to as Dr. Google. They go online, they think they self-diagnose, and we have to sometimes work past that to look at the actual their actual pet to make sure that we're getting things right.
I'm sure that can be difficult because I know for my dog, I'd probably do the same thing. Okay, so what is your favorite part of being a veterinarian?
Favorite part is the same thing, being able to work with people to help them and help their families and help those pets.
Okay. Well, at least you like the challenging part. So what is the most rewarding part?
The most rewarding part is is when you get the thank you card in the mail that you have taken someone's pet that they were very worried about and was having medical issues, and you work with them to resolve those issues, and thereby the pet's feeling better, doing better, and the family as a whole feels better because their pet's doing better.
Okay, so what is the main thing you dislike about being a veterinarian?
The main thing I dislike about being a veterinarian, I dislike the fact that there are a lot of tough decisions that I have to make, and it has to do with somebody else's pet, that they're looking for help, and sometimes there's not really any help to be had. There are problems that just like in people that we don't know how to solve at this point in time.
Okay, so finally, since we are undergraduate students pursuing degrees in the natural sciences and going through the challenges of college ourselves, we're going to ask you some questions of advice. So, for kids or students wanting to become veterinarians, what is your main advice for those students?
Okay. Main advice for those students is that you have to do well with your grades. Okay, you can, in order to apply to veterinary school, you have to have certain prerequisites. But then when you get to apply, just because you're qualified to apply doesn't mean that you get accepted. And there's a large applicant pool with only a certain number of spaces. And one of the most important thing that they look at is your grade point average. The other thing I would say is that just because you're working on grades so much, don't discount the other education that you can have in your life, okay? And that's to mean getting experiences through organizations and traveling and experiencing other cultures and things like that make you a well-rounded individual, so that when and if you become a veterinarian and you're having to communicate with your clients, that you have good communication skills and that you can look at things from different points of view.
Okay. And what was your favorite part of undergraduate school?
My favorite part of undergraduate school, just the experience of making a lot of new friends, getting to be able to pursue different areas of interest, such as in my undergraduate schooling, I actually took a course in welding one semester because I was interested in it.
Okay, and to finalize, is there any last advice that you could give to just undergraduate students as a whole as to what you would say going into college?
Going to college, undergraduate students, I say use your time wisely, okay? Not only for yourself, but for potentially your parents if they're helping you while you're there as well. Be prudent with your finances. It's not always the same for every profession, but I can tell you that in the veterinary profession, it is it has one of the highest debt to income ratios for most people that have graduated veterinary school, and so that's something that makes it more difficult after graduating. So if you can do things to make sure that you keep those parts of it and financial things and loan debt in check, then you're going to have more opportunities once you get done with school.
Alrighty, well thank you so much, Dr. Reinap, for doing this video for us and doing this interview for us.
You're most welcome. I wish you best of luck.